Good morning. Welcome to our daily mobility. Today we're working on our lumbar spine, that low back. We're going to start off with a cat-cow. So on all fours in our quadruped position, and we just want you to try to arch and round just our low belt back, so those pelvic tilts, right? Not getting our upper back involved in that, trying to isolate that out just to the low back. And we're going to do that for 45 seconds. Again, slow, controlled, focusing on the quality of movement versus the quantity of reps back and forth. And don't worry about your range of motion, how far you can actually go. First, focus on just trying to isolate out the movement to that low back. And then you can kind of start getting a bigger range of motion from there. Just keep your breathing nice and steady as you go. Okay, nice, slow, controlled movement. Good. From there, we're going to do a supine sciatic nerve flossing. So laying on our back for this one. What we want to do, so when our legs are straight down here like this, we want to kind of lift our head up, kind of looking at our toe, and we're going to kind of pull just the toe on one leg to start with in towards us. And then as we lift this leg up, we're going to bring the head down, but keep that toe pulled down towards us. We don't want to let the toe point up towards the ceiling. Hold that for a couple seconds, but keep that toe pulled in. As that leg comes down, we're going to lift the head back up. Head comes down as the leg comes up, continuing to squeeze that toe down the whole time. And we're just going to continue for 30 seconds on one side. Hold at the top for a couple seconds. Bring that leg down, keep the toe squeezed in. Lift the head, kind of look at the foot. Head comes down as the leg comes up. Really feel like you're trying to squeeze that toe towards your body the whole time. But continue to keep your breathing nice and steady here as well. Okay, let's switch sides. Again, nice squeeze in. Right, as you come up, the head comes down. Pulling the toe down towards you. Hold for a couple seconds. As that leg comes down, bring the head up, but keep that toe squeezed in. Okay, next up, we're going to do a segmental thoracic extension on our roller. So we're just going to use a roller. If you don't have a roller, even just kind of a rolled up towel or something will work as well too. And we just want to put this kind of just kind of below kind of that upper back, below the shoulder blades. We're going to keep our knees bent. So as we come forward, kind of pulling our chest down towards our knees, we want to hug ourselves here. And then as we start to extend over top of the roller, we just want to reach our arms overhead as far as we can, keeping our hips on the ground. Hold for a couple seconds and then we'll come back forward and really try to round forward. We're going to continue this for 45 seconds. So again, that flexion forward. And then we want to extend over top of that roller. Trying to really bring our head or shoulders, our arms down towards the floor without letting the hips come off the ground. And then come back forward. Keep your breathing nice and steady. Just let the head go back. Really let that big deep breath out as you reach up overhead. Every time you go, you should almost feel like you're getting just a little deeper into that stretch. Okay, last up, we're gonna have a seat. Any chair will do for this. We're gonna take our palms, gonna go on the inside of one knee, our elbow on the inside of the other knee. We're gonna do a QL stretch, so muscles right in our low back here with a reach. So we're gonna rotate our torso, reaching up towards the ceiling, and we're just gonna hold that stretch for 30 seconds on each side. So again, squeeze that arm in between our knees and reach, and we can turn our head to look up towards that ceiling as well too, and kind of like a tip forward. We're not trying to keep our torso upright. And you just want to breathe in and out. In through the nose, out through the mouth. Just trying to allow yourself to kind of even sink a little further forward into it and rotating back a little deeper. All right, let's switch sides. So same thing. Squeeze that forearm between the knees and then reaching up towards that ceiling as we kind of just lean forward, trying to open up that QL in our low back. Nice big deep breaths. In through the nose, out through the mouth. Awesome. Great job. Enjoy the rest of your day. We'll see you back here tomorrow.